Hi, my name is Sharessa, and today I will be doing a heart and lung assessment. We're going to start out on the posterior. We're going to make sure that he understands that if he feels any discomfort at any time, to please state it. If there's any questions or concerns during the assessment, he will please note. We've already done his health history and my hands are clean. We're going to start out and we're just make sure there's no abnormalities. Here, here, or here. Any pain felt? No. We're going to do that one more time. I'm going to ask you each time my hands touch you to say 9, 9. Ready?
9, 9, 9, 9, 9, 9.
All right, and now I'm going to palpate. Whenever I palpate, that is just me touching you. And now I'm going to percuss. Whenever I percuss, it's just whenever I touch you like this and just tap. Okay? All right, now we're going to do the same thing. We're just going to do it with me listening. I'm going to ask that you inhale and exhale each time the stethoscope touches your back. Inhale and exhale. Inhale and exhale. And we're just going to go along and show you the spots for testing purposes. While we have the posterior, we're going to check the kidney. You're just going to feel a little tug, and then if it hurts, just let me know. Was there any pain felt? All right, now we're going to go down, and I'm going to percuss, and if whenever the dullness goes away, and then I'll mark the line. I'm going to ask you to inhale and not exhale until I note. Mark, and we're going to move to the other side. Exhale for me, please. We're going to do this again. Inhale, do not exhale. And exhale. And these lines are both parallel. If you can turn around for me, please. We're going to go to the anterior. We're going to do exactly the same thing. First, we're going to check for abnormalities. And then we're going to do them steps again, and I'm going to ask you to say 9, 9 each time I touch you.
9, 9, 9, 9, 9, 9.
All right, and I'm going to do the palpate again. I'm percussing as I'm palpating you. All right, and then I'm going to listen. As the stethoscope touches you, just inhale, and then exhale, and again, inhale, and exhale, and once again, I'm just going to go through the steps for testing purposes. All right, we're going to move on to the cardiac part. When we do the cardiac part, we're going to start with the carotid arteries to make sure the pulses are detectable, in which they both are. We're also going to look at your full appearance to make sure that your skin is pink and moist and warm to touch. We're going to look at your eyes to make sure they're not bulged. We're going to look at your sclera. It's not irritated, it's not red, it is white. And we're going to look at the mouth. The lips are not purple, blue, they're pink and moist. You can open your mouth for me, please. Inside, you can see that the buccal mucosas are pink and moist. So you got your tongue. All right, pink and moist. The ears are also pink, warm to touch. And on the front, we're going to do the heart tones. You know, the 5 steps of the heart tones. First, I'm going to touch it to make sure there's no pain. And then I'm going to listen. All right. And then also at the front, we want to make sure that we know where the apical pulse is. It's at the 5th intercostal. I'm going to compare the apical pulse to your carotid pulse. Also, while I have you in here, we're going to look at your hands. If you'd place your hands out, please, for me. We're going to do capillary refills. +1, and make sure there's no swelling in the legs or the feet. You can put your hands down. And if you get on the bed for me, please. We're going to go through the same steps on the bed. Laying down, we're just going to check the heart tones. First, I'm going to touch them again, make sure there's still no pain. And then I'm going to listen. Again, I'm going to make sure that I can hear the apical pulse and check it with the carotid artery. All right, that's it. Thank you.